Thanks for coming to listen. It's getting late, so thanks for your attention. So first, my name, Jason Olkowski. So first, I want to thank you for your work. You guys do incredibly important work in, the Department of Health, and you're here tonight, listening to a lot of our concerns, a lot of our, frustrations, and I wanted to take the opportunity to thank you for the good work that the Department of Health does every day, really as almost the last line of defense, protecting our citizens against many different forces. So I have young children. I think until you have young children, you don't think about some of these things, right? You go along life, living recklessly and dangerously, and then you have kids, and life changes, and you begin to think about these things. So I wanted to thank you for that, and I wanted to tell you that just like those young children throughout the state that you protect from lead and many different substances, we need your help here in Burrillville. We need your help badly, and we need your courage. And you are, in effect, our last line of defense as it relates to the health risks associated with this plant, and all health risks, the ones directly from chemicals that people are speaking about, as well as ones like depleted water availability and quality. You're our last line of defense against all of those risks. So we're here tonight, we're saying we need you to protect Burrillville like you protected so many other communities and citizens in the past. And based on that, I would like to echo the concerns that many of my other citizens have said. And I'd like you to take a position that expresses and calls out risks rather than explaining where individual items are not a risk. A great amount of diligence has gone into the draft version of the report. I've read through it in its entirety. There's a lot of information in there, a lot of information that was pulled from other sources and responses, data request responses that were made by the applicant. So a large amount of diligence was put into this. At the same time, I have to be honest, it has the appearance of, in some sections, of kind of checking the box. And it's in those sections in particular that we would like you to pay more attention, because we need you. Again, you're our last line of defense. We need you to instead take a position that exposes and calls out those risks rather than explaining where there aren't risks. Certainly, I think none of us here want another Flint, Michigan. None of us want to preside over one of those stories that becomes a national disaster. And there's a lot going on that's unique to this plant. And I think that's the thing, that when people come to Burrillville and listen to the story and spend some more time looking at the details, everybody walks away, and hopefully you will as well, with an appreciation for this. There's a fairly long list of things that are unique to this plant. And I think oftentimes people are like, well, what's the problem? We build power plants all over the place. Well, we don't build power plants all over the place that are powered by water that's contaminated with MTBE. We don't build power plants all over the place that are resulting in a clustering of plants along the same pipeline, because each individual state, even though we have an interconnected energy grid, approves power plants in a vacuum. And I think, I'm not going to belabor that because you saw the great graphic and illustration earlier. Hopefully you have an appreciation for the clustering that's happening in this region. So, you've heard some of the other things I think that are unique to this particular project as well, as regarding its location. So this is not business as usual, even though this is the types of thing that you guys deal with all the time. Please peel back the layers of the onion and realize that there are some special things related to this project that need to be called out, and that you guys need to caution and warn against. You must take a different position where you're actively, proactively warning and saying we should not do this because of X, versus only saying we recommend that if you do this, that you look for available mitigation opportunities. So with that, I wanted to go through a couple of these items in detail. Through the different sections, if you would allow me just a couple more minutes to go through this. So I'm going to skip electromagnetic fields, and I'm going to go to the section 5 around noise. Starting on page 10, you have some comments in here that recognize the potential impact of noise, but that it was The full impact of the noise generated by the operation of the plant, of the new turbine and the compressor station, in conjunction with existing noise levels, is impossible to predict. Therefore, Rhode Island Department of Health recommends that if the CRC facility is constructed, the facility should work in conjunction with Algonquin to minimize neighborhood noise impacts to the extent possible. Again, I think we need stronger language here. We need to say, if this plant is approved, then you must do X, Y, and Z. You must demand, you're the only person whose opinion will be respected that way. I can say that. I'm not a health professional. I'm not part of your department and your organization. It carries much more weight when you guys, if you are actually concerned that if it makes the kind of noise that would disturb people, then you need to call that out specifically in here. So let me give you an example here. So the frequency in question that's emitted by this type of power plant is known as a high mid-range frequency. And these frequencies are extremely sensitive at the high and mid-range frequencies, with the slightest boost resulting in a huge change in sound. And again, that's the high mid-range frequency. So if this plant was to not be able to meet the sound requirements, keeping it from being heard from people, the frequencies that people do hear are going to be very disturbing to them. Okay? It's not just a low rumbling noise that you might expect in some sort of factory. It's this sort of frequency that happens in startup and shutdown that is particularly disturbing the human ear. So I think something like that sort of information is the sort of stuff that we would be looking for you guys to also call out, so that those that are charged with approving this plant really understand the potential health impacts. So let me skip to section 6, drinking water quality. So this one's been covered quite a bit tonight, so I don't want to belabor it again for you. But I want to read from the report, page 11 of section 6. These concerns include possible groundwater depletion, possible contamination of drinking water wells, exposure to MTBE and other contaminants, and pollutant concentrations in discharged water. Now, those concerns aren't listed in your summary and conclusions. Those concerns are listed in the background section that have been brought up by others. Those concerns need to be moved to your summary and conclusions and issued as a warning. Again, strengthening the language. In the summary and conclusions, you said, while groundwater withdrawals from the MTBE contaminated wells for processed water are not a health concern at this time, these wells may not be used to provide water to the plant's offices. So the only position that you guys took as it relates to MTBE was about the use of the water of the employees there. Do you know how that strikes the town here? I'm just being honest with you. As a resident of the town, looking for my Department of Health to protect me, the only protection that you built into your report was that of protecting the employees of this plant. You did list in the background, you did list these concerns in the background, but you did not pull them forward as part of your summary and conclusions. Again, if you don't, no one else is. So please, help us. Let me skip to section 7 for air pollution. So firstly, again, I'd want to call out as it relates to pollution, the clustering. This is something that's unique, increasingly unique to this plant and to this area. There's no mention of clustering in the report anywhere. There's no mention that says that any sort of approval should be contingent upon a review of all current and future plants planned to be built in that area. I don't think that there's any report that exists today that examines the health impact of this many plants in this small an area. That needs to be called out. If you guys are aware of that study, reference it. If you're not aware of that study, call it out and say this plant should not be approved if we don't have a study that confirms that this sort of clustering is okay. I want to draw your attention to a study that was published earlier this year, January of 2016, in Environmental Science, Process, and Impacts. It was a study from the Royal Society of Chemistry, a team of scientists in Canada. I know it's funny to be talking about snow when it's so hot, when we're in the middle of summer, but it's important to point out because, as you know, we get a lot of snow up here in Burrillville. So the study found that snow in urban areas soaks up the toxic and cancer-causing nanoparticles that are found in car exhaust. The snow appears to be very effective at removing those particles from the air, but then they are of course embedded in the snow. Snowflakes and ice particles with various types of surfaces, including several active sites that can absorb various gaseous or particulate pollutants. Plea, a professor at McGill University and lead author of the study, said, "The research team collected snow for the study from a park in Montreal where it snows 5 months out of the year." Sounds a little bit like Burrillville on some years. They measured they measured the level of toxic compounds typically found in car exhaust, like benzene, toluene, ethylbenzene, and xylenes, which are all considered either carcinogenic, harmful development, or a respiratory irritant. They found that after 1 hour, just 1 hour of exposure to exhaust fumes, the concentration of those chemicals in the snowpack increased dramatically. So the findings suggest a need to study what happens after the snow melts, according to Professor Araya. Since the snow is clearly a temporary sink for pollutants, emissions of such toxins might increase rapidly as the snow melts and the chemicals are re-released into the environment. So, why did I bring up this study? As per the application, these very same chemicals will be emitted from the proposed plant. Now, we're being told that the chemicals will be expelled through such force in the plant that they will reach into the upper atmosphere. I ask you, what about the days when it's snowing really hard up here in Burrillville? Foster, Gloucester, no school. We've all heard that on the TV. You know how much snow we get up here. This study certainly bears some additional examination by the Department of Health, I would think, and I'm happy to provide that to you. On page 14, it says the Rhode Island Department of Health plans to review the HRA as well as RIDEM's permit evaluation and will have the opportunity to supply comment during RIDEM's public comment period if indicated. Again, I would ask you to take a much stronger position here and demand to have the opportunity to both review, comment, and give final say regarding or their final recommendation regarding the HRA as well as RIDEM's permit evaluation. I think you guys have earned that right as the Department of Health. So let me move on a little bit more quickly here. As it relates to asthma, Section 8 on page 16, under summary and conclusions, it says, without an in-depth research study or comprehensive health impact assessment, it is not possible to predict asthma-related impacts specific to the proposed CRC facility. Well, I say let's demand a study. Let's demand the appropriate research. Again, if not you, then who else? I recommend that you strengthen the language there. And in page 17, similarly, it says, without further research, it is not possible to determine the extent of the impact or the level of impact that this facility would have on individual or population health. Rhode Island Department of Health recommends that if CRC is to be built, all possible steps be taken to reduce harmful emissions and mitigate the health impacts of emissions. Again, I recommend that you take a stronger position on that. We'd like to not have the risks reduced. We'd like to have them eliminated. I think if you lived here in this area, you'd have that concern as well. Emergency Response and Prevention, Section 9, pages 19 and 21. This is getting into the chemicals and the types of combination of materials that are going to be stored on site. Again, Rhode Island Department of Health recommends that the model also be run without the assumption and that emergency planning consider the results of the more conservative model run, including the potential for off-site consequences. This is in relation to the fact that Rhode Island Department of Health does not have the sufficient information available to reproduce the model that was run. Again, I would say, don't recommend that the model be run without the assumption that you guys don't like. Demand that as a condition of approval that the model be run. Strengthen this. This is our life. We live out here. This is important. Rhode Island Department of Health strongly recommends the following regarding storage of the facility, of ammonia at the facility. Again, you list a couple of very good recommendations. I'd say we demand as a condition of approval, not recommend.
Do your job.
As it relates to the hazardous chemicals, I think not enough attention was paid to the transportation of those. A lot of good details about the storage of them on site and the way that they need to be handled and protected, and the training that needs to be provided to employees that were on there, or that work there. I think you guys did a good job of outlining that. A big concern of those of us that live around this town and that are going to have these vehicles transporting these chemicals, the diesel fuel, the ammonia, the hydrogen, thundering down our roads, is that more care be taken and called out to the transportation and the potential risks that could happen if accidents were to occur. Again, if not you, then who? I'm quite sure that the EFSB is looking to you to call out those concerns. And if you do not call out those concerns, then they might say, okay, I guess there is not a concern here of a spill that would potentially affect the people of Burrillville. I could tell you, and I think the testimony of many others before me did a much better job than I could of telling you that we don't have a hazmat team. The closest one is not close enough. And I think that needs to be called out in this advisory opinion as well. Also, the places where these trucks are likely to crash and cause an incident, several of these intersections and roads are very close to waterways. Very easy to contaminate those waterways with significant downstream impacts to both citizens as well as animals and other forms. So again, that information needs to be called out, needs to be specified here in terms of the transportation and the potential risks and impact of these. So lastly, as it relates to climate change and health, I think Nick Kaktovich did a great job of saying that climate change should really be incorporated into the Department of Health. It is humans that are going to be impacted by this. In this area, particularly in a state that has 400 miles of coastline, particularly vulnerable to the effects of global warming and climate change here in Rhode Island. Your summary and conclusions for climate change and health state, when considering the expansion of the fossil fuel energy system, Rhode Island Department of Health acknowledges that the potential effects on climate change must be considered project by project and community by community. Rhode Island Department of Health supports the Resilient Rhode Island Act's goals and thus supports any locally requested examination of alternative energy sources and or plans. If and when determined to be at all possible, Rhode Island Department of Health supports efforts aimed at carbon emission reduction and the development of alternative renewable energy sources. I think I get what you guys are trying to say there. I think you're trying to say that we should prioritize the development of renewable sources that don't have a negative impact on the environment. If that's what you're trying to say, come out and say it. Go ahead and put it in there just like that. And here's why, and this is my final comment. I think I've taken enough of my time. Climate change is a macro issue. These macro issues sometimes seem too big to change, affect, or impact, and inertia is a very powerful force. Doing nothing is so much easier than doing something. Climate issues are a macro issue that are fought and won at the micro level, at the local level. And here is one plant in one town that if you're concerned at all about climate change, you can have a voice to impact. So don't forget, the macro issue is defined and won or lost in the micro issues in the local level. So again, I thank you for all your great work that the Department of Health does. Every day, so many things that we don't even know about in the ways that you help us. We're just saying, please, we need some of that help here in Burrillville. Please take a stronger stance. Pay attention to the items that I've outlined and strengthen that. Thank you very much for your time.